Good afternoon, everybody, and thank you for joining us today. We are proud to announce the latest step in MTA's nation-leading response to COVID-19. Starting tomorrow, we're expanding our employee vaccination program to Vanderbilt Hall, right here in Grand Central Terminal. Mobile Health will continue to serve as our health partner for this vital program. I'm thrilled with the selection of Grand Central as the next vaccination site. It will be easier than ever for the hardworking men and women of Metro North to get their shots. But this site will be open to all MTA employees. It is not open to the public. We've said from the beginning that we wanted to make it as easy as possible for every member of the Metro North workforce who is interested in getting vaccinated to get a shot so that our heroes moving heroes can continue their important work. Here at Grand Central, we expect to deliver 200 doses a day, twice a week on Wednesdays and Thursdays. That's in addition to the 100 shots a day that are being provided at the Javits Center and the 200 shots a day that are being provided at the downtown Brooklyn site that we recently launched for MTA employees. That's also 5 days a week. And I'm happy to report that 150 of the 200 shots that are being provided here at Vanderbilt Hall will be reserved for Metro North employees. We are doing everything that we can to get as many transportation workers as we can vaccinated. However, our efforts are dependent upon vaccine supply and availability. Thankfully, we seem to be moving in the right direction on that. But we ask in the meantime for our employees to be patient so that we can do everything that we can to get them vaccinated as quickly as possible. I really want to thank our partners at Mobile Health for helping us launch this new site. Mobile Health has a long history of serving New Yorkers and promoting community health, and we're thankful for their support. I also want to thank all the Metro North employees who've been working so hard in terms of getting this vaccination site up and running. And now I'd like to turn it over to Chris Silvera, who's the Secretary-Treasurer of the IBT Local 808. Thank you.
Good afternoon. So we just want to encourage all the employees to take advantage of this opportunity to come down, get vaccinated, get ready, because this is about how do we return to normal. This is about safety, this is about the health, this is about our families. So I just want to encourage all of our employees, all MTA employees, to come on down, get vaccinated, get involved, and let's get back to normal as soon as possible. Thank you. Turn this over to Mr. Pat Warren, Chief Safety Officer of the MTA.
Thanks, Chris. I want to take a quick minute to do a shout out for the team that's put so much into it. That's Dr. Derry Luisi and Carl Hammond and their teams at MTA and, of course, at Metro North for putting this together in conjunction with the folks from Mobile Health. A really huge effort, and I want to thank them dearly for it. Let me offer a few specifics about the upcoming vaccination operation here. Initially, the vaccination center here at Vanderbilt Hall will be open Wednesdays from 9 a.m. to 5 p.m. and Thursdays from 7 a.m. to 3 p.m. I want to clarify that the site is for MTA employees only. It is not open to the general public. Those employees who are interested can fill out a questionnaire, which the MTA will then use to schedule, make a reservation for them. Like Kathy said, we want to see as many workers as possible get this vaccination. Today, we have gotten shots in the arms of nearly 15,000 employees, well over 20%, and we want to see that number get much, much higher as soon as possible. I'll remind our workers that under distribution guidelines, they are also eligible to get their vaccination in many of the state and city vaccination centers. We recognize that some may be hesitant about getting the vaccine, but the data has been quite clear on this. The CDC and other health experts agree that the available vaccines are safe and effective at minimizing the severe risks of this illness. The safety and health of our workforce is our highest priority. Transportation workers have carried the city on their backs over this last year. If we're going to get back to normal, We all need to step up and get our shots. And beyond the vaccine, we need to use all of the other tools that are available to us to minimize risk. We need to continue following the same guidelines we've all had all along. That is to keep wearing our masks, get tested often, for which the MTA continues to have on-site testing at no cost to our employees, maintain social distancing, wash hands frequently, stay home if feeling sick, avoid large gatherings, and avoid unnecessary travel. Thanks again to the folks of Mobile Health for their partnership. And speaking of Mobile Health, let me now turn it over to Mobile Health CEO Andrew Schulman.
Thank you, Pat. I'm incredibly proud to be back with the MTA again, part of this extremely important initiative. My name is Andrew Schulman. I'm the Chief Executive Officer of Mobile Health. We are an occupational health provider that has been working in New York City for over 37 years, and we are now nationwide, and we provide employee medical screenings like drug tests, physical exams, vaccinations. Just a week ago actually, we stood at 130 Livingston and announced this initiative, and it's great to be here just a week later at Grand Central Station and Vanderbilt Hall to bring this important program to even more MTA and Metro North Railroad employees. Just like at 130 Livingston, safety is our #1 priority. We're providing nurses, medical assistants, required technology, EMS personnel, everything required to implement and administer a very safe program. As the city and the country sets vaccination records, it's great to partner with an organization that is clearly forward-thinking and at the forefront in knowing that the next step is to bring vaccinations to people. We've got Javits Center, Yankee Stadium set up for everyone to go there, but MTA is, like I said, forward-thinking and knows that we need to remove as many barriers as possible and make it as easy as possible for everyone to get their vaccine, and has done so both in Brooklyn and here to bring the vaccinations to the employee workforce. On behalf of Mobile Health and our entire team, I want to thank the MTA, and like Pat said, specifically Dr. Luisi, Dr. Bienenfeld, Michelle Dunn, and right here at Grand Central, Jonathan Lee and Matt Peloso. You guys have been amazing to work with, and we look forward to a continued successful partnership. Thank you.
Thank you so much.
Okay, and you're all set.
Okay.
All right, now just relax the arm.
Yes, ma'am.
I'm gonna clean the area. So just bring it up. If you could help me,
Sure.
hold this up. Just hold it right here. And relax the arm. Put it on the top. There you go.
I prefer not to look, okay?
Okay.
Thank you.
Okay, so you're gonna feel just a slight little pressure, okay?
Yes, ma'am. And you are wonderful.
Thank you.
Shall I hold that?
Okay.
Yay. I'm so excited. Thank you so much.
You're welcome. All right, so I'm gonna set a timer.
Yes,
I'm gonna
ma'am.
sit for 15 minutes, and you will be monitored. And after 15 minutes, the nurse will stick it in your shoulder.
Perfect. May I put the gun on? I'm official, guys. Yay. Are you excusing me now to the back?
Yes.
Thank you. Feels wonderful. It feels very good. She's a wonderful shot. I'm very excited about this. Now I can go back to, doing my job and everything, feeling healthier, feeling safer. It was so uncomfortable. I was scared, but it feels good. I'm very happy to have this opportunity.
Yeah, no. fine.
Good, thank you.
Thank you very much.
It's banded. You can remove at any time. I'm only putting it just in case you have any type of feedback.
Okay.
Yes, I'm gonna set this timer for 15 minutes, and you're gonna sit and be monitored. Once your 15 minutes is up, you're free to leave. Okay? Thank you.
Thank you very much.
Good day.
Yes, yes. Metronov made a specific portal to show to see who's interested in the vaccinations.
Can we get your name and your last name, please?
My name is Frank Simmons.
How much Simmons?
I'm sorry?
Can you spell your last name for us?
SIMMONDS.
And you work for Metronord?
Yes, I do.
What do you do?
I'm a foreman of the M&V department, maintenance of equipment.
Thank you.
You're welcome.
Very excited to put this behind us, right?
Yeah. It's only a needle. Don't pass out.
If I do, I'll be on camera. I'll be a star.
I think you can keep your right arm down so we can get the shot going in.
Sure. Let me just slip a little more for you, okay?
Okay.
Is that good?
You're gonna have to hold it up. Can you hold it up for me?
Yeah.
Do you want the shot?
Yeah. I'm gonna get. Is that good?
Okay, so just a slight discomfort.
Okay.
No bleeding, but you can remove this at any time. Okay?
Thank you.
Okay, you're all set. How you feeling?
Great.
All right, so we're gonna set this timer for 15 minutes. You're gonna sit and wait. After the 15 minutes, you'll be free to leave.
Okay, thank you. Do I need that paperwork?
Yes. you're
Okay.
gonna take it.
Okay.
Thank you so much.
Thank
Have
you.
a good day.
Appreciate it.
How do you feel now that you finally got the vaccine?
Oh, I feel good. Excited, relieved. I'm very happy that the vaccine's available here in Grand Central, Vanderbilt Hall. Such a convenient location. It's a very important step for myself, frontline workers, all Metro North workers, to get it. Especially being here at a convenient location, I think it's really essential to get a lot of the transportation workers vaccinated. We all have various schedules, it makes it more difficult. But I'm confident that the unions can work with Metro North to get it all done quickly and try to put things behind us and make this a safer, healthier work environment and really country like it was such a long year ago. So very different.
What does the vaccine mean to you?
Well, it means I could actually go see my mom more often. It means I could go visit my grandmother more often. It's just the sense of not getting the virus and passing it along to family members or friends really means a lot. But I think also keeping society going.
Okay, you can have a seat.
Really been a traumatic year for everyone.
What is your name?
Edward Valenti.
The last name
First name Edward, last name Valenti. V as in Victor, A-L-E-N-T-E.
What is is your job?
I'm a conductor, and I'm also the general chairman of the Association of Commuter Rail Authorities.
For Metro North. You're a conductor for Metro North?
Conductor for Metro North, and yes, the general chairman. Thank you.
I'm going to clean the area first, okay? It's going to be just a slight discomfort.
Oh, I missed it.
You're all set.
Thank you.
How you feeling?
Good.
You good? Okay, so I'm going to give you your paperwork and you can go on to the next. Thank you so much.
Thank you.
Okay, you can step forward. You can have a seat. How are you?
Good, how are you?